Hey, Dr. Birchler from Chirohouse Spine and Disc Center. One thing that comes up in conversation with parents who have kids is often this concept of growing pains, especially a kid might be in, say, sports or something like that, going through a big growth spurt. And people use this term growing pains. And one of the questions that comes up is the pain have anything to do with growing? And my answer to that is basically no. It doesn't. A bone doesn't hurt because it grows. Otherwise, every single thing would hurt. Your head would hurt, your shoulder would hurt, every single part of the body was hurt. So the bone, it doesn't hurt to grow, but when the body's going through big growth spurts, kids are getting tall quickly. They still may be pretty thin. They have this kind of Bambi legs and things. The joints are less stable. They haven't filled out muscularly yet. The body might be not be adapted to that height yet in terms of stabilizing the joints and things. And some of those things can lead to some joint stress and joint pain, in particular when you get into athletics and things where there's a lot of physical activity stress going through the joint. So what we want to look for in general is if the body has an imbalance, something is uneven mechanically while it's growing, well then you get the knee hurting or the hip hurting or the back hurting or something like that during those growth phases. But it's not just because the bone is growing. So when you hear that term, or if you have kids that are having these kind of things and you think growing pains, or a doctor says that, or just somebody says that kind of thing, I would immediately go to have their body checked mechanically, because it doesn't hurt to grow the bone. So there could be something wrong causing them to have more pressure, more stress on that area as they are legitimately going through the growth phase. I got into chiropractic as a teenager in athletics, and while I was probably mostly through my my growth phase by the time I got into it at age 15, I can identify with that. That's kind of how chiropractic started for me, is at that early teenage years in sports, and having some issues back and knees and things like that, and body needs some attention. So if you have questions on this, if you're a patient here, ask us about the situation, or have your kid come in. Of course, if you're not a patient here, call, ask us questions, or schedule time to visit, and we can take a look at the situation and see what we can do to help.